Hi, this is Elliott Martin,
And I'm Becky Hatfield.
and we're coming to you from opposite ends of the country today to talk about Medicare
We're asking,
and answering all your questions related to Medicare so that way you can make an informed decision. This is the Medicare Navigators podcast.
hi, Elliott.
Hey, Becky, how are you?
Good, how are you?
Doing great. And actually, one thing I want to just note is Becky and I met in person for the first time in between the last podcast and this podcast. You were out here visiting your family in California, in from North Carolina, right?
Yes, it was so nice. I brought my middle son with me. He's 7. He doesn't remember California at all.
Mm,
So I got to take him to all my childhood spots that I would go growing up, my neighborhood
mm.
pool, my favorite beaches.
Yeah. So your
Um,
son, he was born in California?
He was not born in California.
Okay.
So I was born and raised in California
Yep.
and then obviously live over here now in North Carolina.
Yeah.
He was born here,
Got it.
but he has been to
He has been.
California when he was younger, but he doesn't remember.
Got it. Got it.
So,
Okay. Oh,
yeah.
very cool. Very,
Yeah. So
very
it
cool.
was super fun and it was nice to finally meet you guys in person.
Yeah. Yeah. You've been working with us for a year now, and that was the first time. It was great to meet you.
I know, I know. And it's funny that we've been working together this long, and I've never gotten to ask you how it was that you decided to work for the family business. So obviously your
Mm.
dad started Martin and Associates. Was it back in 1986?
So he got licensed in 88, I think it was. He got his life and
Okay.
health insurance license. He's kind of dabbled around with various lines of insurance. I think he did long-term care, life insurance he was doing, individual health insurance. And then he also, I think he started in the 90s, he started doing some Medicare supplements and then really didn't start seriously, like serious focusing on Medicare supplement till maybe the late 90s, early 2000s. Yeah.
Okay.
Yeah.
Okay. So then you're a kid during this whole time, like you were a 90s kid, right?
Yep.
So born in the 90s and you're growing up, you're watching your dad start his business, get it off the ground. Were you like, someday I'm gonna work with my dad? Or were you like, no?
Nah, I never had a bad attitude towards it. I think I just didn't really understand what he did. I can remember like thinking, oh, my dad sells life insurance, but I don't really know what life insurance is, or I didn't really understand that world very much. But as I started to, go through high school and into college, I kind of knew that I would, eventually would like to be in business for myself. I didn't really want to really be a clock in at 9, check out at 5 o'clock type of employee.
Mm,
Working for some big corporation. I just watching my dad was able to make it to pretty much all my baseball games growing up, throughout high school and little league and all that. So just seeing that sort of flexibility that he was able to juggle. We had 4 kids. I've got 3 siblings, so being able to have a little bit of flexibility and adjust things around was just a really cool just to have my dad out there and available, not on these long business trips or having to stay 9 to 5 at the office. So, he would work from home a lot of times. And my dad hated the summertime because all of us kids, if we weren't in camp, we were hanging out at the house, causing noise and mischief. And I can just remember him trying to quiet us down while he was on the phone. So I kind of, grew up seeing that and listening to my dad talk on the phone with clients and meeting a lot of his clients as well. People that we would see, we would be invited over to for dinner and we would even go to concerts with some of his clients. So just kind of a cool relationship and, something that I got to experience. And I think I kind of knew deep down inside, okay, this is something that interests me. I kind of want to learn more about it. And actually, when I was at college out in Indiana, I went to Valparaiso University. I actually got my California insurance license before I graduated. I took my test in Chicago, at a proctored test center in Chicago. Um,
wow.
so I actually got my California insurance license while I was in Chicago or while I was in Indiana. So I kind of
Wow.
knew that, okay, I should get this license. I should be prepared so that way I can kind of jump in on things and hit the ground running. So,
Wow, that's fascinating. It's
yeah.
cool because I feel like a lot of times when you grow up and you kind of have a family business, a lot of times kids are like, I'm never going to do what
Yeah.
my parents do. I'm going to do my own thing. I'm going
Yeah.
to strike out on my own. But it's neat that you were never antagonistic towards it. You always saw the benefits of it, and you saw that there was just a lot of goodness there.
Yeah. Yeah, because and it's funny because I hear all the time for clients of ours who own their own businesses, a lot of them say, yeah, I got I can think of a couple different people who they've got children that are now running the businesses or involved in the business heavily. But I do get other people who say, oh, I wish my kids would be interested in doing this. They just never were. So it just,
Oh,
it's I think my dad feels lucky to have not only one but two sons in the business and maybe even a third son in the business. So
I
yeah.
know, because your youngest brother might be joining you guys soon.
Yeah,
So
he actually just got his insurance license. So he's not officially with us yet. He's kind of dabbling in and we're having him do a couple things here and there, but he did just get his insurance license. So we'll see what happens.
that's amazing. I
Yeah.
love it.
Yeah.
I need
It's
to
very fun.
apologize to my dad because he was in insurance and I always was the kid that was like, I will never, never do that. That is
And look
so
at you
boring.
now.
I know, I know. It's like to all the parents out there who are like trying to raise their kids and,
Yeah.
you know, do all the right things and everything, and your kid is still like, no, I'm not going to do what you say. Like,
Yeah.
look at me,
Yeah. Back in
I'm doing it.
insurance.
So,
Yeah.
yeah,
Kind of a
I do.
sideways approach back into insurance. Not,
I
yeah.
know.
Yeah.
I know. I do really like what I get to do though, because I feel like it's more on the creative side.
Right.
So
Right.
that part for me is fun.
Good.
Um, so this is the month of April, and we are going to be talking about and focusing our conversation on people that are about, like, maybe they're about to turn 65.
Mhm.
The wheels are turning. They're starting to think about Medicare. What am I supposed to be doing? And obviously, you have some time before you're 65, Elliot. You have a few years ahead of you.
Couple years.
Um,
Yeah.
but you would, if you were about to turn 65, because you are a licensed Medicare agent,
Yeah.
um, you you would probably know at this point what you would need to do if you were about to turn 65. And so I think what I would like to do is just ask you some questions. Like, if you
Okay.
were about to turn 65, what would you do in these situations if that works for
Yeah.
you?
That works great. That's a
Okay.
great topic.
Yay. Okay. So the first thing I wanted to ask you was, if you were about to turn 65 and you were enrolling in Medicare for the first time,
Mhm.
how would you go about doing that? When would you start that process? Who would you reach out to first? All of the ins and outs. You're starting from scratch. You're enrolling in Medicare for the first time.
Yeah. Good question. Okay. So let me use my birthday as an example. So my birthday is October 2nd. So the month of October, let's say I were turning 65 in October of this year. I could actually start the process to apply for the basic Part A and Part B 3 months in advance. So if I subtract 3 from 10, that puts me into July, 10, 9, 8, 7. So starting in July, as early as July 1st, I would want to go ahead and apply for the basic Part A and Part B, which I would do through the Social Security website. So I've already got an account, a login created on the Social Security website. So I can go in, I can see my earnings history, what my Social Security benefit would be when if I'm 65 or 66 or wait till 70. That's also the account where I would go to apply for Part A and Part B, the two basic parts of Medicare. So that's step one, is everybody who needs to start using Medicare, meaning they don't have any employer group insurance. I'm self-employed. I actually have insurance through my wife, Casey, but let's say she was still working and I was still covered through her insurance at Cal Poly. I actually wouldn't need to apply for everything. I would just apply for Part A only. But let's say my wife, Casey, was retired, which that's her plan, is to retire well in advance of 65. And, maybe we're just writing out our Cobra insurance, or I had to go get my own individual family plan for the Martin family. At 60, approaching 65, I would then need to apply for Part A and Part B through the Social Security website. So that would be step one, is
Okay.
get that done.
So it starts with the Social Security website.
Right.
Is
Yep.
it better to go online to the website, or is it quicker to go into the Social Security office physically?
So if you're applying at your 65th birthday, it's easier online to do it just online. That's the easiest way. You don't have to, it takes only, if you know what you're doing and you've got the account already created, it only takes about 10 minutes to do an application online. You could probably even go quicker than that because it's pretty straightforward. What I talk about a lot is if somebody's needing to activate Part B later, then usually if your local Social Security office will take walk-in appointments, that's usually what I would suggest, is to get that Part B activated in person, because that in that situation, that's going to be the quickest. But if I'm just turning 65, easiest way to apply for Part A and Part B is online, definitely.
Okay. So that kind of leads me into my next question. So you talked a little bit about if case you were to continue working,
Yep,
and you didn't need to apply for Part B, you would just apply for Part A.
right.
And so you wouldn't be penalized for holding off on Part B, right? If she's still covering you under her employer group insurance.
Right. So really what Medicare looks at currently is there's two things for you to be able to delay Part B, as in Bravo, penalty free. Is one is your insurance based on either yours or your spouse's active employment. So if my wife Casey, if she were still working, we could say yes, she's still working, she still got coverage through Cal Poly, and she is covering me under the Cal Poly insurance. So that question is answered yes. And then really the only other requirement is, does the employer have 20 or more employees? Okay. And obviously that at a campus, at a college, a university, that for the most part, that should be a yes, right? 20 or more employees. So as long as those two requirements are met, I could have delayed, or I could delay Part B penalty free as long as she's still working and we've got coverage through her employer.
So is that something that they would ask you on the application for Part A? Or do you have to tell them that?
No, you don't really. Well, they do ask. They do ask if you have insurance based on employment. If you would like Part B, you would just answer no to those questions, or yes to you have employer group insurance. No, I don't need Part B. So you can kind of answer those questions if that situation applies to you. And then you don't have to activate Part B.
Okay.
But
Now,
there's really no verification or of anything until that person goes to activate Part B later. Then
got
you
it.
need to show proof. Hey, I was covered through Cal Poly Insurance. My wife got this document signed off, and that allows you to activate Part B later, penalty free.
Okay. So I guess that sort of answers my question about if you were about to turn 65 and you wanted to keep working
Hmm.
and you had group employer insurance, your employer had 20 or more employees,
Yep.
and you wanted to keep working, would you need to still go on and apply for Part A? Or can you just wait on the whole thing until you do need to activate Part B, the medical insurance?
So I would suggest applying for Part A, just to get into the Medicare system. You get issued out a Medicare card, and it'll make your life a lot easier when you go to apply for Part B later. So that's normally what most people will do if they're still working, 20 or more employees at the company, they're covered by insurance through their employer, is they'll activate just Part A at 65. But here's one caveat to that is, if you have an HSA or your spouse has an HSA, there's extra rules when it comes, I think IRS rules when it comes to HSAs, health savings accounts, where the IRS, I believe, does not like overlapping Medicare coverage with HSA contributions. So that's where things can kind of get a little bit tricky. There's a little bit of nuance to that where, yeah, depending on the situation, you may not want to apply for Part A either, just to avoid any possible goof up with the IRS.
Got
But
it.
I always caveat this with, talk to a tax professional. I am not a tax professional, so always a good idea to talk to a tax professional.
Yeah, that's always a good idea. So going back to the original question, you are about to turn 65, you're
Mhm,
enrolling in Medicare for the first time.
mhm.
Let's say in this situation, you don't have employer group coverage, you do want to activate Part A and Part B.
Yep.
What about the other parts of Medicare? What about Part D? What about a supplement? When would you go about applying for those?
Yeah, so you can go ahead and apply for those as soon as your Medicare A and B gets approved. You get a Medicare number, you get your Medicare ID card. Then you can actually go and purchase the extra insurance, the supplemental
Okay.
insurance, prescription drug insurance. If you want to go Medicare Advantage, you can go that route. I mean, one good spot to start is the Medicare website, medicare.gov. What I tend to hear is that, yeah, the medicare.gov, it's, there's a lot of information there, but it's almost too much information, and trying to sort out and figure out what information applies to me, what information doesn't, it can be a little bit challenging. So, and of course, I'm a little biased. My suggestion would be to try and work with an independent insurance agent, a broker, for these Medicare plans. For the most part, a lot of brokers, they will contract with a lot of the different nationwide carriers, maybe even some local carriers if you find somebody local in your area. You can always contact us, Martin and Associates. We're licensed in 30 different states. But that would be the way I would suggest if I, if I were doing this on my own and I wasn't my own broker, I would go out and try and find somebody who can kind of help me through this situation, who knows the ropes, knows who's competitive, and so forth.
Thank you so much for joining us for another episode of the Medicare Navigators podcast. We have a weekly Medicare 101 webinar that we would love to have you join us on. Go to our website at www.martinmedicare.com to reserve your spot today. Please join us again next week as we continue this conversation. All information related to this episode is listed below in the show notes.